Assalamu alaikum, doctors. Today we will start our cardiology. So let's start with a very important topic, angina, stable angina pectoris, the drug management, okay? Okay. So, okay. So first thing first, let me tell you something, some important points that you cannot forget. What are those? Just some key points. As I'm telling you, I'm always simplifying with some key points so that how I was remembering, and I want you guys to remember easily in that way also, inshallah. So the fact is that angina pectoris or stable angina, the management is usually either with one drug or it could be with two drugs. You can maximize up to two, okay? But if somebody needs 3 drug combination, that means actually that patient is not that much controlled, right? You have to give him 3 drugs to control that angina. So he needs assessment, right? He needs assessment. Maybe he will need PCI or maybe he will need CABG. So that's the fact you need to understand, that usually 2 drug is okay. If 3 drug combination you need to give the patient, of course, obviously, you will send them for further assessment, that if he really need PCI or CABG, like that. Got my point? So this is one of my point. The another thing is that now start with all of the patient, what you are giving, what you should give. They should be aspirin and statin. Aspirin and statin, okay, all patient. If there is like any acute attack is there. So that's why you have to give them always the GTN puff. You know, we are supplying them GTN puff and tell them to keep it with them whenever they're going outside or inside the home. So if anytime there is any attack, they can have them sublingually, the GTN. Got my point? This is the short acting one. That's why we are giving sublingually. So whenever there is attack, for that, you have to give the patient on aspirin statin. All patients, they should be with that, and also they should have this sublingual GTN supply. Okay. So this is the starting point, that you cannot forget this. Now come with the other drug, step-by-step drug management. Okay, drug management. Now, let me just draw it. So we will start with our drug management. Okay. Okay. So first thing first, we are using with one drug, as I told you, either one drug or 2 drugs. So first, of course, you will start with one drug, right? So it could be beta blocker or it could be calcium channel blocker. Okay. So regarding this beta and calcium channel blocker, beta blocker may be that atenolol. Calcium channel blocker, if you are using alone, I mean monotherapy, that time what we know regarding this calcium channel blocker, we know that there are 2 types of calcium channel blocker. One type, they're working on the drugs as a rate limiting, working on the heart as a rate limiting drug. Those are verapamil and diltiazem. Right? And some are dipyridine. These are working on the vessels. So that one is amlodipine and nifedipine. So whenever you are using it alone, it should be either vera or diltiazem. Either vera or diltiazem. But don't use this amlo or nafi. Only when you are doing the combination of with beta blocker, that time only you have to go for the amlo or nafi. Otherwise, monotherapy always with this vera or dil. Especially when you are doing the combination, you never can use this vera or dil along with beta blocker. Okay, because they are both rate limiting. Rate limiting drugs you cannot use as a combination. Okay, dear? Okay. So now one drug I told you, beta blocker and calcium channel blocker. Usually beta blocker, atenolol we can use. Then next, if you are coming to our next point. So next is that there was a question. The patient was on beta blocker, but atenolol, but he was on a low dose. So they told you have to dose up. You have to increase the dose up to maximum dose. Atenolol you can use up to 100 mg. Got my point? Then next point is still the patient is not, maybe the patient is on beta blocker, and then you increase the dose, still he is not controlled. Then you have to combine with beta blocker with calcium channel blocker. Okay, or maybe the patient is on calcium channel blocker, he's not controlled, you have to combine with beta blocker. So the final result is you have to combine both of them. You have to combine them. You have to combine BB plus CCB. Got my point? So either if he was on BB, you will combine it with CCB. If he is on CCB, you will combine with BB. So our end product is BB plus CCB. This is our second. Okay. So if still one of them is not contraindicated or not controlled, so that time you can step up to some other drug. You can combine with other drug. Okay, maybe some patient with sick sinus syndrome, so they cannot tolerate the calcium channel blocker. So with beta blocker, you have to choose another drug according to the side effect. Okay, so this is the stage which is very important. You need to remember, you just cannot forget those. So what are the drugs? The drugs is that it could be long-acting nitrate. It could be nicorandil. Okay. It could be ranolazine. It could be ivabradine. So these 4 drugs you need to remember. Now, you need to exclude. So if you will get all the options, all the drugs as your options, and you will also get in the scenario some contraindication. Okay, some situation they will tell which are contraindicated. Like in case of long-acting nitrate, if the patient was like having hypotension, you cannot use that. Okay. Nicorandil again, if it is like cardiac output low, like hypotension, or maybe with left ventricular failure, or maybe cardiogenic shock, you cannot use this nicorandil also. You got my point? Okay. So ranolazine, you see ranol, the name, from the name. If renal function test, RFT dearranged, you cannot use. If LFT dearranged also, you cannot use. I got two different questions. The one was with LFT dearranged, one was with RFT dearranged. So you cannot use ranolazine with them. Okay. So ivabradine, like sick sinus syndrome, if they are mentioning, there was a question, sick sinus syndrome, you cannot use ivabradine. Sick sinus syndrome also CCB is contraindicated. So you need to know in which condition which drug is contraindicated, then you will make the combination. This is the thing that you need to remember. Okay, this is all about our stable angina treatment. Okay, hope it will help you, inshallah. Thank you everyone. Thank you so much.